Question 1. A technician in the decontamination area is assigned to clean a heavily soiled flexible gastroscope. To ensure compliance with the specific standards for effective processing of flexible endoscopes, which organization's guidelines should the department strictly follow? A. Society of Gastroenterology Nurses and Associates, SGNA. B. Occupational Safety and Health Administration, OSHA. C. Environmental Protection Agency, EPA. D. National Fire Protection Association, NFPA. Correct answer A. Knowledge point explanation. Core Rationale, SGNA is a voluntary professional organization that specializes in endoscopy issues and establishes the accepted standards for the effective processing of flexible endoscopes. Their guidelines are critical for preventing healthcare-associated infections related to complex gastrointestinal devices. Trap analysis. Option B is incorrect because OSHA regulates occupational safety and worker protection, not the clinical processing steps for medical devices. Option C is incorrect because the EPA regulates environmental disinfectants and emissions, not the clinical guidelines for endoscope cleaning. Option D is incorrect because the NFPA develops fire safety standards, which are unrelated to endoscope reprocessing. Concept extension. SGNA guidelines are often used in conjunction with ANSI/AAMI ST91, Comprehensive Guide to Flexible and Semi-Rigid Endoscope Processing in Healthcare Facilities, to create a robust quality assurance program. Question 2. Which of the following agencies functions as a specialized branch of the United Nations to further international cooperation in improving global health conditions and disease control? A. World Health Organization, WHO. B. Centers for Disease Control and Prevention, CDC. C. Association for the Advancement of Medical Instrumentation, AAMI. D. American National Standards Institute, ANSI. Correct answer A. Knowledge point explanation. Core Rationale. The WHO is a voluntary, non-regulatory agency at the international level that promotes global health, establishes international guidelines for infection prevention, and coordinates responses to global health emergencies. Trap analysis. Option B is incorrect because the CDC is a U.S. federal agency focused on domestic public health, not a United Nations branch for global cooperation. Option C is incorrect because AAMI focuses on developing consensus standards for medical instrumentation processing, primarily in the U.S. Option D is incorrect because ANSI coordinates the U.S. voluntary standardization system, rather than acting as an international health organization. Concept extension. While WHO guidelines are technically voluntary, they heavily influence the creation of national policies and standard precautions in developing countries worldwide. Question 3. During a multidisciplinary meeting between the Sterile Processing Department, SPD, and the operating room, or, a dispute arises regarding the proper aseptic presentation of sterile instrument trays. Which organization's nationally recognized guidelines for the perioperative setting should the team consult to resolve this issue? A. Association of Perioperative Registered Nurses, AORN. B. International Organization for Standardization, ISO. C. United States Pharmacopoeia National Formulary, USPNF. D. Food and Drug Administration, FDA. Correct answer A. Knowledge point explanation. Core Rationale. AORN develops voluntary recommended practices and guidelines specifically for the perioperative environment. Their standards ensure seamless patient safety protocols from instrument preparation in the SPD to aseptic presentation in the surgical suite. Trap analysis. Option B is incorrect because ISO creates broad international technical standards, not specific clinical nursing guidelines for the OR. Option C is incorrect because USPNF focuses on standards for medicines, food ingredients, and purified water quality, not aseptic presentation. Option D is incorrect because the FDA regulates the manufacture and market approval of medical devices, not the clinical practice guidelines for surgical staff. Concept extension. AORN often collaborates closely with AAMI to ensure that their guidelines for perioperative practice align perfectly with ST79 steam sterilization standards. Question 4. An SPD technician accidentally splashes a high-level disinfectant onto their forearm while manually cleaning an instrument. The facility's safety officer investigates the incident to ensure the worker was provided with appropriate personal protective equipment. Which federal regulatory agency enforces the laws designed to protect this worker from occupationally caused illnesses and injuries? A. Occupational Safety and Health Administration, OSHA. B. Environmental Protection Agency, EPA. C. The Joint Commission, TJC. D. Centers for Disease Control and Prevention, CDC. Correct answer A. Knowledge point explanation. Core Rationale, OSHA is a regulatory government agency dedicated to protecting the health and safety of American workers. It enforces mandatory regulations, such as the Hazard Communication Standard and the requirement for proper personal protective equipment, PPE, to prevent occupational injuries. Trap analysis, option B is incorrect because the EPA regulates environmental protection, air, water, and disinfectant registration, not the immediate physical safety of the worker. Option C is incorrect because TJC is an accrediting body that surveys overall hospital quality, not a federal agency enforcing worker safety laws. Option D is incorrect because the CDC provides voluntary guidelines for disease prevention and infection control, but lacks the regulatory authority to enforce occupational safety laws. Concept extension. Under OSHA's Hazard Communication Standard, all workers have the right to know about the chemical hazards they face, which requires the department to maintain accessible safety data sheets, SDS. Question 5. Which independent, non-governmental international organization provides state-of-the-art specifications for products, services, and good practices to enhance global competitiveness and ensure integrity? A. International Organization for Standardization, ISO. B. Association for Professionals in Infection Control and Epidemiology, APIC. C. American National Standards Institute, ANSI. D. United States Department of Transportation, DOT. Correct answer A. Knowledge point explanation. Core Rationale, ISO is a global, voluntary organization that develops technical and management standards for various industries, including healthcare. By standardizing specifications internationally, ISO enhances global competitiveness and ensures consistent quality worldwide. Trap analysis, option B is incorrect because APIC is a professional organization for infection preventionists focused on disease control protocols, not international manufacturing standards. Option C is incorrect because ANSI coordinates voluntary standards strictly within the United States, not globally. Option D is incorrect because the DOT is a U.S. federal regulatory agency that enforces domestic transportation laws, completely unrelated to global manufacturing specifications. Concept extension. ISO 13485 is a critical standard specifically detailing the requirements for a comprehensive quality management system for the design and manufacture of medical devices. Question 6. An SPD manager is informed that a team of surveyors has arrived unannounced to evaluate the facility's compliance with national healthcare standards. This rigorous on-site survey, which occurs at least every 3 years, is critical for maintaining the hospital's accreditation and federal funding. Which quasi-regulatory organization conducts these evaluations? A. The Joint Commission, TJC. B. Occupational Safety and Health Administration, OSHA. C. Centers for Medicare and Medicaid Services, CMS. D. The Food and Drug Administration, FDA. Correct answer A. Knowledge point explanation. Core Rationale, TJC is an independent, non-profit organization that provides critical evaluations and accreditation for healthcare facilities. Although compliance is technically voluntary, It acts as a quasi-regulatory body because accreditation is often required to receive Medicare and Medicaid reimbursement, ensuring facilities adhere to the highest quality and safety benchmarks. Trap analysis. Option B is incorrect because OSHA conducts inspections strictly for worker safety violations, not general hospital accreditation or patient care standards. Option C is incorrect because CMS relies on TJC's deemed status to verify compliance rather than conducting the primary routine hospital accreditation surveys themselves. Option D is incorrect because the FDA regulates medical device manufacturing and market approval, not the overall operational quality of a hospital. Concept extension. During a TJC survey, inspectors will heavily scrutinize the department's strict adherence to the manufacturer's validated instructions for use, IFU, for all processing equipment. Question 7. To prevent the rapid corrosion and severe staining of delicate surgical instruments, the decontamination area must utilize high-quality purified water for the final rinse cycle. Which independent scientific organization creates and revises the authoritative standards for the quality, purity, and strength of processing water used in healthcare facilities? A. Environmental Protection Agency, EPA. B. United States Pharmacopeia National Formulary, USPNF. C. Association for the Advancement of Medical Instrumentation, AAMI. D. American National Standards Institute, ANSI. Correct answer B. Knowledge point explanation. Core rationale. The USPNF is an independent organization that establishes critical standards for medicines, food ingredients, and specifically, the purified water used for medical irrigation and final instrument rinsing. These quasi-regulatory guidelines ensure that water impurities do not compromise the sterilization process or damage expensive surgical assets. Trap analysis. Option A is incorrect because the EPA regulates the environmental discharge of wastewater and drinking water safety, not the clinical-grade purified water required for instrument processing. Option C is incorrect because AAMI develops overall sterilization and equipment processing standards, but defers to USPNF for specific scientific water purity formulas. Option D is incorrect because ANSI merely coordinates voluntary standards across industries without independently writing the technical specifications for water purity. Concept extension. Poor water quality not only causes physical damage to instruments but can also impede the biocidal efficacy of high-level disinfectants and liquid chemical sterilants. Question 8. Which federal regulatory agency is exclusively empowered to create and enforce stringent laws relating to cleaner water, air, and land, thereby directly controlling the registration of environmental disinfectants and the atmospheric venting of toxic ethylene oxide, EO, gas? A. Food and Drug Administration, FDA. B. Occupational Safety and Health Administration, OSHA. C. Environmental Protection Agency, EPA. D. Centers for Disease Control and Prevention, CDC. Correct answer C. Knowledge point explanation. Core rationale. The EPA is a powerful government agency responsible for protecting human health and the environment. It strictly regulates hospital-grade surface disinfectants under the Federal Insecticide, Fungicide, and Rodenticide Act, FIFRA, and controls hazardous air emissions like EO under the Clean Air Act. Trap analysis. Option A is incorrect because the FDA regulates sterilants used on critical medical devices, not the disinfectants used on non-living environmental surfaces like floors or countertops. Option B is incorrect because OSHA focuses strictly on the exposure limits, PELs, for workers inside the building, not the environmental impact outside the facility. Option D is incorrect because the CDC provides disease control guidelines but has no legal authority to regulate environmental emissions or register chemicals. Concept extension. Using an EPA-registered disinfectant in a manner inconsistent with its detailed labeling, such as ignoring the mandatory wet contact time, is a direct violation of federal law. Question 9. After identifying a cluster of surgical site infections, the SPD leadership collaborates with specialized facility detectives to review internal decontamination protocols and hunt for the root cause. Which voluntary professional organization represents these dedicated individuals working tirelessly to prevent healthcare-associated infections? A. Association for Professionals in Infection Control and Epidemiology, APIC. B. Society of Gastroenterology Nurses and Associates, SGNA. C. Association of Perioperative Registered Nurses, AORN. D. The Joint Commission, TJC. Correct answer A. Knowledge point explanation. Core Rationale, APIC is the primary professional organization for infection preventionists, IPs. These specialists analyze data, investigate infectious outbreaks, and work hand-in-hand with the SPD to ensure all processes effectively mitigate the risk of healthcare-associated infections, HAIs. Trap analysis, option B is incorrect because SGNA focuses strictly on gastroenterology and endoscopy nursing practices, not the broad, hospital-wide prevention of all infectious outbreaks. Option C is incorrect because AORN represents surgical nurses focused on the perioperative environment, rather than specialized epidemiological investigation. Option D is incorrect because TJC is an accrediting body that evaluates hospital standards, not a professional membership association for infection control practitioners. Concept extension. In the event of a documented biological indicator, BI failure, the SPD must immediately notify the infection preventionists, APIC members, to initiate a potential recall and assess patient risk. Question 10. A technician prepares a sealed, rigid, puncture-resistant container filled with heavily soiled biohazardous surgical instruments. The container will be loaded onto a truck and driven 15 miles across town to an off-site centralized reprocessing facility. Which federal regulatory agency strictly enforces the laws governing the transportation of this medical waste on public roadways? A. Environmental Protection Agency, EPA. B. U.S. Department of Transportation, DOT. C. Food and Drug Administration, FDA. D. Occupational Safety and Health Administration, OSHA. Correct answer B. Knowledge point explanation. Core Rationale. The DOT is a federal regulatory agency responsible for ensuring safe transportation systems. Because soiled medical instruments are classified as biohazardous materials, the DOT strictly enforces the packaging, containment, and labeling laws required when these items are transported between facilities on public roadways. Trap analysis. Option A is incorrect because while the EPA regulates the final environmental disposal of medical waste, it does not govern the physical transportation logistics on highways. Option C is incorrect because the FDA regulates the clinical efficacy of the instruments themselves, not how they are securely driven across state lines or city streets. Option D is incorrect because OSHA regulates worker safety inside the facility, whereas DOT jurisdiction takes over once the vehicle hits the public road. Concept extension. To comply with DOT regulations, the transport container must be clearly and visibly marked with the International Biohazard symbol to warn emergency responders in the event of a traffic accident. Question 11. An SPD clinical educator is drafting a comprehensive departmental policy regarding proper hand hygiene and isolation precautions for processing 15 soiled instrument trays. To ensure the policy aligns with the industry's accepted standard of care, the educator must consult the major federal resource for healthcare guidelines. Which agency publishes these critical infection prevention documents? A. Centers for Disease Control and Prevention, CDC. B. The Food and Drug Administration, FDA. C. Environmental Protection Agency, EPA. D. Occupational Safety and Health Administration, OSHA. Correct answer A. Knowledge point explanation. Core Rationale. The CDC is considered the leading federal resource for healthcare guidelines. While not a regulatory agency, its comprehensive publications on disinfection, sterilization, and disease prevention are the definitive standard of care utilized by all major accrediting bodies. Trap analysis. Option B is incorrect because the FDA regulates the pre-market approval of medical devices, not the creation of clinical infection control guidelines for hospital staff. Option C is incorrect because the EPA regulates environmental emissions and surface disinfectants, rather than publishing comprehensive healthcare disease prevention protocols. Option D is incorrect because OSHA mandates worker safety laws, such as bloodborne pathogen training, but does not serve as the primary resource for clinical healthcare infection guidelines. Concept extension. The CDC's guideline for disinfection and sterilization in healthcare facilities heavily relies on the Spalding classification system to dictate the necessary level of processing. Question 12. The sterile storage area in a hospital is undergoing renovation to house an additional 500 pounds of highly combustible disposable paper wrappers and 20 gallons of flammable alcohol-based hand sanitizers. To ensure the structural design mitigates catastrophic risks, which organization's international standards must the facility consult? A. National Fire Protection Association, NFPA. B. American National Standards Institute, ANSI. C. U.S. Department of Transportation, DOT. D. The Joint Commission, TJC. Correct answer A. Knowledge point explanation. Core rationale. The NFPA develops critical international standards designed to reduce the risk of fire and other hazards. Because SPDs store large quantities of flammable materials, like plastics, wrappers, and chemicals, compliance with NFPA building and fire codes is essential for life safety. Trap analysis. Option B is incorrect because ANSI coordinates the U.S. voluntary standardization system but does not independently author the specific international fire safety codes. Option C is incorrect because the DOT strictly regulates the vehicular transportation of hazardous materials on public highways, not the stationary storage of combustible items inside a facility. Option D is incorrect because TJC evaluates overall hospital quality and surveys compliance, but they utilize the specific fire codes written by the NFPA. Concept extension. The NFPA 704 standard is immediately recognizable by its color-coded fire diamond label used on chemical containers to quickly communicate health, flammability, and instability hazards to emergency responders. Question 13. Which of the following federal agencies is legally structured under the Department of Health and Human Services and actively promotes public health by preventing and controlling disease, effectively acting as the nation's premier health protection agency? A. Centers for Disease Control and Prevention, CDC. B. World Health Organization, WHO. C. Food and Drug Administration, FDA. D. Occupational Safety and Health Administration, OSHA. Correct answer A. Knowledge point explanation. Core rationale. The CDC promotes public health through the aggressive prevention and control of infectious diseases. Their exhaustive research and published guidelines form the absolute foundation of infection control practices utilized by sterile processing professionals daily. Trap analysis. Option B is incorrect because the WHO operates globally under the United Nations to manage international health crises, not as a U.S. federal agency under the Department of Health and Human Services. Option C is incorrect because the FDA's core mission is ensuring the safety and efficacy of medical devices, drugs, and food, rather than focusing purely on broad epidemiological disease prevention. Option D is incorrect because OSHA operates under the Department of Labor and exclusively targets the occupational safety and health of the American worker, not broad public disease control. Concept extension. While CDC guidelines are not technically federal laws, ignoring them leaves a facility highly vulnerable to negligence lawsuits and loss of accreditation. Question 14. A medical device company engineers a sophisticated Class 3 implantable cardiac pacemaker. Before this high-risk, life-sustaining device can be legally marketed and distributed to hospitals, which federal regulatory agency is exclusively responsible for its pre-market approval and post-market surveillance requirements? A. Food and Drug Administration, FDA. B. Association for the Advancement of Medical Instrumentation, AAMI. C. Environmental Protection Agency, EPA. D. International Organization for Standardization, ISO. Correct answer A. Knowledge point explanation. Core rationale. The FDA has the absolute statutory authority to classify all medical devices based on patient risk and mandate rigorous pre-market and post-market requirements. For Class 3 life-sustaining devices, the FDA requires comprehensive scientific evidence of safety and efficacy, PMA, before allowing the device to enter the healthcare market. Trap analysis. Option B is incorrect because AAMI is a voluntary organization that develops consensus processing standards. It does not possess the legal government authority to grant pre-market market approval for medical devices. Option C is incorrect because the EPA enforces environmental protection laws and registers surface disinfectants, not implantable cardiac devices. Option D is incorrect because ISO develops global quality management specifications, like ISO 13485, but cannot legally authorize the sale of a medical device within the United States. Concept extension. The FDA also strictly monitors device safety after market release through the MedWatch program, requiring facilities to report severe adverse events or deaths associated with equipment failures. Question 15. Which private, non-profit entity enhances global competitiveness and quality of life by strictly ensuring the integrity of the U.S. voluntary consensus standards system, although it does not directly write or develop the technical standards itself? A. American National Standards Institute, ANSI. B. International Organization for Standardization, ISO. C. Association for the Advancement of Medical Instrumentation, AAMI. D. National Fire Protection Association, NFPA. Correct answer A. Knowledge point explanation. Core rationale. ANSI acts as the central coordinator for the U.S. voluntary standardization system. It accredits the procedures of standards developing organizations to ensure they are fair, open, and consensus-based, thereby enhancing global competitiveness and securing the integrity of documents like ST79. Trap analysis. Option B is incorrect because ISO writes its own distinct international standards for global manufacturing, rather than acting strictly as an accrediting coordinator for domestic U.S. voluntary standards. Option C is incorrect because AAMI actually authors and writes the technical standards for medical instrumentation processing, which are then submitted to ANSI for approval. Option D is incorrect because the NFPA independently authors comprehensive fire safety codes and standards, rather than functioning as the overarching accreditor for all U.S. industries. Concept extension. When you see a standard labeled ANSI/AAMI, it signifies that AAMI's technical document was rigorously reviewed and officially recognized by ANSI as a true American national standard. Question 16. A hospital is upgrading its low-temperature sterilization capabilities by installing a new ethylene oxide, EO, sterilizer. Because EO is a highly toxic, carcinogenic gas, the facility engineers must install an exhaust emission control system, such as a catalytic abator, to prevent the gas from polluting the outside atmosphere. Which federal regulatory agency enforces the Clean Air Act and is strictly responsible for regulating these hazardous EO emissions into the environment? A. Environmental Protection Agency, EPA. B. Occupational Safety and Health Administration, OSHA. C. Food and Drug Administration, FDA. D. The Joint Commission, TJC. Correct answer A. Knowledge point explanation. Core rationale. The EPA is the federal agency with the legal authority to protect the environment and public health from toxic pollutants. Under the Clean Air Act, the EPA establishes strict national emission standards for hazardous air pollutants, including the amount of EO gas a facility is legally permitted to vent into the outside atmosphere. Trap analysis. Option B is incorrect because OSHA regulates the indoor, occupational exposure limits for the healthcare worker, such as the 1 part per million, or ppm, permissible exposure limit over an 8-hour shift, not the environmental emissions vented outside the building. Option C is incorrect because the FDA regulates the sterilizer's effectiveness on the medical device, not the ecological impact of its exhaust. Option D is incorrect because TJC evaluates overall hospital accreditation and policies, not the federal environmental laws governing chemical air pollution. Concept extension. Proper ventilation systems for EO sterilizers require a dedicated exhaust line that is completely separate from the facility's general HVAC system to ensure toxic fumes never recirculate. Question 17. During a routine total knee arthroplasty, a newly purchased surgical power drill severely malfunctions, shattering a burr and causing a life-threatening injury to the patient. Under the Safe Medical Devices Act, SMDA, the healthcare facility is legally mandated to report this catastrophic event. Which federal agency is responsible for administering the mandatory program that collects these adverse event reports? A. U.S. Food and Drug Administration, FDA. B. Occupational Safety and Health Administration, OSHA. C. Centers for Medicare and Medicaid Services, CMS. D. Centers for Disease Control and Prevention, CDC. Correct answer A. Knowledge point explanation. Core Rationale. The FDA manages the MedWatch program, which is the nation's primary medical product safety reporting program. While voluntary for individual healthcare professionals, it is a strict legal requirement under the SMDA for user facilities to report device-related deaths or serious injuries to the FDA and/or the device manufacturer. Trap analysis. Option B is incorrect because OSHA requires the reporting of severe workplace injuries suffered by the employee, not medical device failures that harm the surgical patient. Option C is incorrect because CMS focuses on the financial reimbursement penalties for preventable, never events, rather than serving as the central regulatory clearinghouse for national medical device malfunctions. Option D is incorrect because the CDC tracks and investigates infectious disease outbreaks and epidemiological data, not the mechanical failures of surgical power tools. Concept extension. If the specific manufacturer of the defective medical device is unknown, the facility is required by law to submit the adverse event report directly to the FDA within 10 working days.